dig you by the wool. Playing I could dig you by the wool. But I'm the wool sculptor. Don't you know I'm the zookeeper? Dig you by the wool. You think you want to dig you by the wool? Fire! Lord, yeah. I'm Mrs. Brown, Mrs. Brown, Mrs. Brown, Mrs. Oh, Lord. I'm Mrs. Brown, Mrs. Brown, wanna hold right down. Yeah, no, no, no. I'm Mrs. Brown, Mrs. Brown, you're too wicked. Hey, hey, hey. I'm Mrs. Brown, you can't hold right down. Lord, under attack from friend and foe. From Mrs. Brown and Co. Under attack, Lord, you're firing from her roadside track. Mama, under attack from Heckle and a Jekyll. Them have a bigger time plot. Under attack, Lord, you're firing from her roadside track. Lord, 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 yeah. I wanna make two. I do want to make four. I couldn't take the deal that they were giving, so I walked right out their door. Now Mrs. Brown, them a frown. Her golden goose is gone. She planned a secret war. Said she wanna even the score. Lord, yeah. I'm Mrs. Brown, Mrs. Brown, Mrs. Brown, Mrs. Oh, Lord. I'm Mrs. Brown, wanna hold right down. Can't hold on, Rasta. I'm Mrs. Brown, you too wicked. Hey, hey, hey. I'm Mrs. Brown, wanna hold right down. Lord, under attack from Sergeant and Corporal.
All right, that is where I want to say a special greetings and welcome to all of you locked into this space at this time. Welcome to the program Civic Vibes. This program is aired each and every Sunday right here on the social media platform. We do this program live on Facebook and also we stream it on YouTube as well. To our Twitter fans, good afternoon to you guys. And so we are welcoming you here this afternoon, just about 10 minutes past the good old hour of 6 o'clock. A little delayed start, technical issues, but we are here and we are ready to go nonetheless. The number of you already on the live feed is pleasant. Good evening to you. Alvin Thomas, wherever you are this time, the co-host of this program. Good evening to you, my brother. Alvin, by the way, will not be here with us this evening in the flesh, as it were. He's out there doing something that will not permit him to be here with us, but I know he's listening and locked in nonetheless. So Alvin, you and your family, good evening to you, my brother, in a very special way. We also have this evening two very special invited guests here, no stranger to us in Dominica, by the way, in the name of Mrs. Rosie Felix. Whenever Rosie speaks, then you must listen. And so we invited her back here this evening to talk on a topic that is right down her alley in terms of health. And that health, yes, it is your right. Today, the 7th day of April 24 is designated by the United Nations as World Health Day. And so we have in our midst two health practitioners in Dominica in the name of Mrs. Rosie Felix, as I said before, and also later coming in into the program, Dr. Irvin Pascal. So these two esteemed persons will be basically contributing to the program here as we want to unpack that all-important topic as designated by the United Nations, your health, your right. And so folks, those of you who are here, your duty at this time is to share that live feed, make someone know that that conversation is happening and that they too can be part and parcel and even partake of the conversation here. The numbers to call into the program later They are 245-2396 and also 615-9470. These are the numbers to get your voices into the conversation as we are moving on. We have a number of folks already here. Helenia, John Rustong, you're just tuning in. Ivinia Joseph, Simeon George, Alvan, Christopher, Franklin, Timothy, Mali, Austri, Anthony, Simon, Everlasting, Peter, Franklin, Timothy, I mentioned your name already. Eliza Louis Gomes, good evening to you. Carla Guy. We also have Miss Watson Duvini, good evening. Dorian, Dorival, Joan Felix Sylvester, Miss Annie Edwards, good evening to you and your husband over there and the entire family. Annie, Alistair Irish, the Baphisted crew, good evening to you. Carol Olivachi Bruni, Lucina, let me get that name right, because I normally used to see before Lucinda, but it is Lucina. McDowell Thole, always nice to have you on board, Lucina. Shara Tiana Judges, my good old friend, good evening to you, my friend, as well. Carlos Charles, good evening to you and the entire family as well. Say a hi and hello to Lambi. We knew that Lambi was not too well of late, but hope that he is doing okay. Jess Viville, you're there. Rosa Robinson, Ramona St. Rose, Bath Estate again, good evening. Brother Dave Bertrand, and the entire listening and viewing audience here. Let me see if I could punch some more names here as we're moving along. Martin John Baptist, Juanita Prince, Manuel in Pierre. Manuel in Pierre, we spoke this week. Good evening to you. Not under the best of circumstances, though. You lost your nephew, but you know, that is part of life, and so be encouraged. Brian Francis, you're also there as well. Good evening to you. Royston Francis as well. Celestine Bontif, Dory, my brother Dory Drago, always locked in. Dory saying good evening, big brother Lofty Durant, esteemed panel, and my fellow patriots locked in from North Carolina. So brother Drago, special good evening to you. We also have here Yusila, James, Claudia, Carlton, and the list goes on and on. Folks, in the interest of time, we have to say that Mrs. Felix will be here with us till about 7 o'clock. Brother Pascal will be coming in about just the 7 o'clock hour. So yes, we have to get things going here. So without further ado, folks, let me now move across to Mrs. Felix and say a big hi and hello.
Thank you, Lofty. Good evening. Good evening. Thanks for having me back. Good evening to all the listeners, all the followers, those who are there every week, those who pop in once in a while. So good evening to all the Dominicans and the non-Dominicans, everywhere you are. A special good Sunday evening to you.
Yes, indeed. Rosie, that smile of yours, it is infectious. And so, you know, I know already some persons are really warming up to that big broad 9:15 smile I normally say. It is stretching from ear to ear. So good evening to you, Rosie, and a very special. Rosie, in terms of just, you know, starting the conversation, how are you? How are things been with you?
Oh, I'm good. I'm good. Lofty, you know, I'm Catholic and we just celebrated Easter. We're in the Easter season and Easter is my favorite, one of my favorite times of year. It just tops up and boosts up my self-confidence, my boldness, my power, because it all comes from the risen Lord. As we celebrate it each year, we are reminded, hey, you know, you cannot keep truth in the grave. They tried, you know, well, after the crucifixion, of course, Jesus was buried, and everybody thought that was the end of it. His disciples, his apostles were afraid, but when he rose again, well, that just gave the disciples and everybody else, you know, his followers, what they needed to just go on with his mission. And the same is with me here. It gives purpose and meaning to life. According to the popular song, you know, tomorrow, you know, because he lives, I can face tomorrow. So that's what's happening with me, Lofty, and proud to confess it. The Lord is risen.
Yes, indeed. And so that is the reason for the season.
Amen.
Amen. All right, folks, those of you just tuning in at this time, you have not missed anything much, but just Rosie's introduction, as it were. Let me just recap the topic for those of you maybe just tuning in at this time. This evening's topic, it is your health, your right. And that topic, basically, it stemmed out of the fact that today, yes, Sunday, the 7th of April, is designated as by the United Nations as World Health Day. And so we know in Dominica the situation of the health department, the health care situation in Dominica. And so this conversation is dubbed to be a very interesting one as we are moving on here. And so Civic Vibes, that organization is not a one-track organization, as it were. We, look at dates and we recognize the dates and the times that are associated with dates. And we always usually pull a group of people across the table that can have this kind of conversation as it pertains to the different things happening around us that are affecting our daily lives, either negative or positive. So hence today, the conversation will be surrounding our health issues in Dominica. All right, folks, so please bear that in mind as we are moving on here. Remember, Dr. Pascal will be here with us about 7 o'clock, and most likely Rosie will make her exit when he makes his entrance. But we are there and we are ready to go all the better. Rosie, let me just play right about now, just to start the conversation, Rosie, a very simple but very profound statement from the director of the World Health Organization, that is Dr. Tedros. Let's just get that on the screen, and then Rosie, to start the conversation here, we'll ask you for some of your comments from Dr. Tedros. Let's see if we can get that on the screen as we're about to make a start.
Since 1948, WHO has worked for the right to health. On World Health Day, we ask, what can you do to claim your right to health? The answer is a lot. First, know your rights. You have the right to quality health services, education, and information. Your health depends on safe drinking water, clean air, good nutrition, quality housing, decent working and environmental conditions, and freedom from violence and discrimination. Second, stand up for universal health coverage. Everyone should have access to the essential health services they need when and where they need them without facing financial hardship. Third, hold your leaders accountable. Mobilize your community, get involved in health decision making, and monitor progress, because the right to health belongs to you.
Yes, so folks, here it is. You just heard it from the director himself, Dr. Tedros. You're right. Your health is your responsibility, which is a right as well. Nurse Felix, you heard Dr. Tedros' statements. I don't know if you want to inculcate some of what you heard from him, and as you give us your opening comments here. Again, welcome.
Thank you again, Lofty, and welcome to all your visitors. Of course, Dr. Tedros spoke to the theme, and of course, I searched to find out what aspects of the theme the World Health Organization is looking at, and Dr. Tedros spoke to that. And it's the reason they chose the theme, My Health, My Right, is to champion the right of everyone, everywhere, to have access to quality health services. And quality here is the key word, quality, not just health services, but quality health services, education and information, safe drinking water. And safe drinking water always takes the front burner when we talk about health, because water is life, number one. Secondly, many diseases can be prevented if we have water for hygiene purposes and safe water to drink. Clean air, of course, because polluted air gets us sick. There are many respiratory diseases and polluted air contributes to that. Good nutrition, healthy food, fresh food. That's important. Quality housing. Now, generally when people think just of health, just think, okay, prevention of disease. But all these factors are important to prevent disease and to maintain health. So the clean water, the air, fresh air, the environment, the food we eat, quality housing. People, we will know, irrespective of our age, if we just do a little search, we'll realize that housing is a basic human need. And when we don't have proper housing, safe housing, it increases our risk to disease. So that's also is a health right. A decent working conditions. You see, you cannot escape it. We cannot escape all these things because they're tied in with health. If you're not first of all, if you're not working, you don't have finance to maintain a healthy lifestyle. Where you affording the foods that would provide you with the good nutrition? How will you be able to afford the housing where you could be safe from the elements? So decent working conditions and environmental conditions and freedom from discrimination. We cannot get away from this one either. And no matter what is one's social status, if there is discrimination from religious discrimination, political discrimination, racial discrimination, it limits your experience of good health, or it contributes to bad health, including mental health. Because good health is not necessarily the absence of disease. It has a lot to do with our mind, our spirituality, and our social well-being as a whole. And so the more people understand their rights to health, the right to health and what impacts their health in a positive or negative way, the more they will embrace health and increase their position on the health continuum. The health continuum is like a scale. At 0, you're very healthy. But when you go down the road, go down to the other end of the scale, it's where sickness and disease come in. So knowing your rights is very important. And I must say, when I speak to people about, say they're complaining of how their health, their right to health was violated in some way, and I ask them, but did you speak up? Did you make a report? And people are afraid. They say, I am afraid that I will be treated worse. So they're aware, but they're afraid that they'll be treated worse, so they do not step up. But folks, that is important. Standing, knowing your right to health and everything that impacts your health is very important, and speaking up to it is important. He also spoke about holding leaders accountable, and that's important too, because we each, even if we have our private doctor and private nurse, we don't have our private hospital, we don't have our private health center, and so on. So it's a service that the government must provide, and must provide it well.
Yes, indeed. Ms. Philip, thank you very much for those very fundamental points that you laid down there as we opening up that all important conversation. You reiterated the point that Dr. Tedros opened up with in terms of knowing your right as it pertains to health. That is so fundamental in that you said it. A lot of persons, they may be treated They may not be treated well, especially in the area of healthcare, or they may be deprived of certain healthcare situations. And they may be afraid to speak up because, as you said before, they fear that when they go back to that health practitioner or that health organization, wherever it's at, they may be treated worse. But Dr. Tedros opened up with that, in that that is a right. And so once a right, which is your fundamental right, and we're speaking health now, it is trampled upon, it is abused, then there should be a level of going in another direction to get some sort of redress. And so I just want to echo that point as we're moving on, and impress on the listeners and viewers' mind, wherever you are across the world. We're in Dominica now, but from the World Health Organization standpoint, it is enshrined somewhere that your right to health, it is a fundamental right. So no matter if you're in Zimbabwe, you're in China, you're in Russia, you're in Dominica, health is a critical component of some of your rights that are enshrined in the human rights across the world.
Yes, lovely. And I want to, if time permits, is for us to look at some of those rights in reference to the remarks by Dr. Tedros, and in respect again to the reason why the theme was chosen. And I want to quote from Nursing Fundamentals, the patient's Bill of Rights. And it's important when people seek health care that the health facility provide you with a list of what are your rights and responsibilities, by the way.
Yes.
And yes, rights and responsibilities. And when I was a young nurse, and even before I became a nurse, a lot of emphasis, we got impression that your right and your responsibility was to go to the doctor, or go to your health center, take your medication, exercise, full stop. It's much more than that. And even now, there's some people, they put a lot of emphasis on exercise, and that's good, because exercise has many benefits for health, but it doesn't end there. The more you know your rights, when you seek healthcare, whether it's from a private facility or a government facility, the more you know your rights and responsibilities, the better you can contribute to restoring your health and maintaining your health. And the first right here in the Bill of Rights, and I'll read it as is: the patient has the right to considerate and respectful care. Considerate and respectful care. And this particular right doesn't cost the provider $1. It doesn't cost the facility $1, because this has to do with your professionalism and your attitude. You may be missing fundamental pieces of equipment, but the respect is how I communicate to you, how I attend to you. And that is a fundamental, the number one patient right. And I've heard many people complain about the way they are treated. And we're not talking yet the medical treatment or the procedure that was done, but what persons who are professionals, what they're supposed to say. And of course, in the healthcare industry, we have persons who are non-professionals, but they are provided with training to get them to a basic level of treating patients respectfully. In other words, how I treat the patient irrespective of my supplies and my technical skills, the attitude, it should be so respectful that my patient should even feel better mentally, that is, in my presence, because I am respectful. We talk about respectful and compassionate care. That's a basic right. Another right, the second one, the patient has the right to and is encouraged to obtain from the physician and other direct caregivers relevant, current, and understandable information concerning their diagnosis, their treatment, and their prognosis. A lot of persons, a lot of healthcare givers violate that right, and the patients don't even know it. And some who know it, they're afraid. They're afraid to ask questions. Hello, it is your right for the caregiver to tell you what is wrong with you. It is their responsibility to take a history from you. So when we ask questions, you know, when did this happen? Is it the first time? So we ask a barrage of questions. Yes, this is to know your business, but it's to better care for you. But after we've gathered this information and we have made an assessment and a diagnosis, we are supposed to tell you, it is your right to know what is the diagnosis, what is the disease, what is it. It is your right to know how I'm going to treat you and options. There are, in most cases, there are many options. It is your right to know. So if the doctor says, okay, this problem, you need an operation, you should ask, doctor, is there another option? And if the other option is drugs, the drugs supposed to be discussed. The drug options should be discussed. So information about, relevant information about what is happening to you and in a language that you can understand. One of my done, or rather to identify when other professionals, when they are using what we call medical jargon for the patient, they don't understand. We have to break it down. And that's your right. Doctor, what do you mean by that? Nurse, what do you mean by that? And we have to say it in a language that the patient can understand. And if we don't do it, it is the patient's right to ask. Some patients say, but the doctor's so busy. So it is your right to ask, and it is a responsibility to respond.
Yes, it is our responsibility to ask and the doctor's or healthcare practitioner responsibility to respond. Thank you very much, Rosie, for that indeed. Rosie, you made a fundamental point earlier as well as we're moving on here, that when some persons think about healthcare, they are basically thinking about, you know, the wellness of the body, but they're thinking about physical health. You mentioned psychological, mental, and other situation as well is part and parcel of that whole healthcare package that we spoke of. Can you just go into that a little deeper, please?
The mental aspect, right?
Yes, please.
Good. So, lovely, everything affects our mind. So we have a body, but we have a spirit, we have a mind, our brain, or what we think. It's abstract. You cannot touch the mind. You cannot touch, we're speaking here, you cannot touch our feelings, but we have feelings. When we started, I said, I'm quite happy to be back here, but you cannot touch my happy, but you can look at me and see, you know, have an idea if I'm happy to be on the program or if I'm speaking in a manner that's, I'm not really happy to be on the program. So that mind is important. And when we seek healthcare, well, it's our first responsibility to take care of our mind, to guard our mind, because there are many things around us that affect that mind. And the healthcare facility, be it a hospital or private provider's office, supposed to be contributing to mind wellness. So our first responsibility, I said, but the health facility the health provider is supposed to be contributing to that as well. And for many of us, depending on how our age group, we, in fact, very early, we learn to protect that mind. We learn to know what affects the mind. Unfortunately, sometimes we dwell a lot on what, you know, affects the mind, and stress. So stress is a condition which is responsible for maybe over 90% of physical disease. So stress, it bothers the mind, it puts pressure on the person. Some people succumb to mental illness as a result of the level of stress they're going through. Some people, they do not get the mental illness, and depression is a very common one, manifestation of stress. And so some people succumb to disease in the body, and some succumb to the mind disease, which is mental illness. And we have to take that into consideration when we give care to people as healthcare providers, and when we are receivers of healthcare. We have to consider that too, because as I said, sometimes things are said to us that doesn't contribute. In fact, it makes us feel worse. I like to tell my colleagues, something I often tell my colleagues, or rather, let me backtrack. At nursing school, I learned about therapeutic self. Therapeutic self is a concept where your personality and your attitude can help heal a patient. Let me give you an example. So say I do a procedure for patients, say a wound dressing, and I welcome the patient and tell the patient what I'm going to do. And I haven't even done the procedure yet, but the patient feels so welcome and so relaxed in my presence. The patient says, "Nurse, I'm feeling better already." Many nurses would experience that, those with good therapeutic self. When they come on duty, some patients say to them, "Nurse, I'm so happy you came. I'm already feeling better." The therapeutic self. And yet to others, they say, when a health care provider leaves the shift, the patient says, "Good riddance." You getting my drift, Lofty?
Yes, I am. I am following you.
Yes. So that is what happens when the healthcare provider has that therapeutic self. It lends to healing the patient's mind.
Mm-hmm.
It helps to contributing to the patient's wellness. Of course, as I said, to begin, the responsibility is ours. When we are children, the responsibility is our parents to teach us how to protect our mind, to feed our minds with healthy concepts, healthy vibes that makes us strong, and to protect the physical health as well.
Yes, indeed. We have some comments already here coming from the live feed. Thank you very much, Mrs. Felix, for your comments here thus far. Ready topic, folks. If you're just tuning in now, it's about 20 minutes to the hour, 7 o'clock. We're about to have in our presence in a bit Dr. Pascal himself, who is a healthcare practitioner in Dominica. We have some comments, as I said. Let's go to the live feed, as it were, so that we could get some comments to make it a little more interactive. I'm knowing that you guys' comments are very important to what we do here on the program. Karen Joseph writes, and nurse, take particular attention to that comment because I'll be asking you for your response. She writes here, if these are coming, and that is the ad we played before she's referring to, are coming directly from the World Health Organization, then who is responsible for ensuring that these are met and or not in violation of by these countries? Why isn't anything being done about what is happening in Dominica? She asked that all-important question. It's one thing to have policies, rules, and laws, but what is the World Health Organization doing to ensure that the countries such as ours in Dominica is not in violation of these? Nurse, your comment.
One of the things WHO is saying, again, this World Health Day, is that every law counts, and speaking to governments, they say every law counts, and every ministry can and should legislate to realize the right to health across the full range of sectors. What I have found, and it was brought into sharp focus during the pandemic, is that the World Health Organization, it makes statements. They meet the World Health leaders, they make policy statements, and they publish those statements, and then it goes nowhere. It goes nowhere. They don't go into any country and enforce anything. They do evaluation. They come up with evaluation. I remember some years ago, PAHO evaluated our health system with a particular focus on primary health care, and many things for evaluation came up, because you all know our primary health care was on a very high level. Many things came up as to where our primary health care should have been further. But what happened? What we saw is a decline. This world international organizations, they put things out there, but they don't come into any country and they don't put anything. What I know they do, though, they create and they fund programs to assist countries. They fund programs and to assist countries to get to the level of the very policies that they make. But each country has that responsibility to get to that level. And unfortunately, Dominica has gone back in many ways. We all know that. And but here it is, World Health Organization is saying to the public, hey, speak up. It is your right to hold your leaders accountable. So Dr. Tedros is not going to come to Dominica and have a meeting with the Minister of Health and the government. It is us. So often, locked in the past, when I used to be on 2 occasions, I was president of Dominican Nurses Association, and we've had protests on apart from working conditions, we've had protests for matters concerning the public. I remember a typical protest. We had a whole week concerning the Marigold Hospital, and people don't join us. People don't join us. People should be joining. What's his name? Ronald Charles had several one-man protests. People should be joining health professionals, or they should be starting those protests. But again, even before the protests, the discussions, I know people call, yes, we have those discussions on the radio, but call up your parliamentary representatives. You can do that. Write them up. Write some articles and publish them. It is our right to do it. It is our right to call them out, to hold them accountable. Accountable seems to be a bad word for many people when they don't want to account. But it's important. Had the public in Dominica, we're speaking Dominica now, had the public come out and be more aggressive in holding our government accountable as it pertains to our health, we wouldn't be where we are. We're in a bad state, you know. We have a building that looks pretty from the outside, but it's lacking quality healthcare. Evaluation, I don't know any hospital that's worth its salt will have a proper functioning, well-staffed quality control department. We probably have 1 or 2 persons in the quality control department, but having a department that is running, people would be saying less of the things they're saying, would be hearing more positive things about our health system had we had a proper quality control department. That's important. Dr. Tedros talked about quality health services. He didn't just say health services quality is important.
True, true, true.
Quality is important, and we have to demand quality.
True. Nurse, we have been focusing our efforts here so far, really discussion on government and the policies as it relates to health care, that is. Let us stretch it a little bit and go now into the private sector arrangements. For example, if some employer or employers out there may have some business places out there, and then the working conditions are not up to par as it pertains to lending support to persons' health care, in terms of they not, they may be affected adversely whilst they are at that workplace. Would you say or suggest that that is part and parcel of the infringement on their rights, as it were, especially where health is concerned?
But of course, the health provider is supposed to be working in a healthy environment to be able to provide quality health care. And the recipient of health care is supposed to be accessing care in a healthy environment. It goes both ways. And the right of the recipient of health care is to demand that. So if the environment is unsafe, the persons who are accessing healthcare ought to speak up to the owners. Begin with that, and it is a responsibility to begin with the person providing that care. Say, hello, Mrs. So-and-so, I'm seeking healthcare here, but look, your seating arrangement is not safe, or people are mopping while patients are going in and out, wet floors, provide a risk. If people are coming in and going, it's a crowded space as well. If it's a crowded space, that's a problem. People are in and out coughing, and because crowded homes lend to disease. Crowded waiting areas also lend to disease. So it's our responsibility as healthcare recipients to raise it with the person providing the care. And if nothing is done, then we have to take it to the next authority, because I believe there is an act that speaks to healthcare facilities, and there are standards that are to be met, and so it is our responsibility. So whether it's a private facility or government facility, we should request and demand safety. Because if I come to your health facility for X, and say I come for surgery, and the floor is wet, and I slip and fall, or I get, because in private hospitals abroad, hospitals pay a lot of money when the patients get infections they did not come into hospital with. And that's why, again, it's important for the quality, for constant monitoring of how your staff deliver the care. Do they have the proper equipment? Oftentimes I hear my colleagues complain they do not have adequate, or they have shortages of paper towels to wipe hands, liquid soap to wash their hands. In the absence of those, you're going to be spreading infection.
True.
It's
true.
also a patient right, by the way. If a health provider approaches you, you notice they just finished caring for one patient, and they come straight to you and touch you. You notice they have not washed your hands in a polite way. Excuse me, nurse. I noticed you didn't wash your hands. Would you do that before? You don't say you préjugé, but that's a basic hygiene practice in decreasing spread of infection.
Yes, indeed. Nurse, as well too, I was asking you really a more direct question. I see you zeroed it on the healthcare, private healthcare facility. For example, if someone has a business place in Dominica, private business, and the place, for example, is infested with mold, and the workers keep complaining time over time that, hey, Mr. Manager, Mr. Bossman, Madam Supervisor, that place is getting me sick. Whenever I come there, I feel nauseated. I'm just not feeling myself. Whenever I'm out, I feel okay. Once I'm in, what would you say to that situation as well, as per the conversation?
Oh, okay, I got you. Of course, anywhere people, because Dr. Tedros spoke to safe working environments. So the environment ought to be safe. So whether it's mold or I said any crowdiness, whatever it is, and if the owner is not doing something about it, the workers should speak out. They should report. They should report. There's a labor division. There's a labor division. They can report the problem too, and until something is done, the employer should address it. Otherwise, guess what? When your workers get sick, what happens? When your workers get sick, they can't deliver for you. So your company is going to lose out. Your company is going to lose out. So it should be addressed, whether the workers go to the public, to the labor division, as it is a private entity, and it should be addressed. The workers should be moved to another safe working environment.
Yes, indeed. Someone just texted me there, and it's alerting me of the fact that today being World Health Day, Nurse Felix, we just see the arrival as well of Dr. Irvin Pascal. We'll be talking to him in just a bit.
Welcome, Dr. IP.
That from the Ministry of Health standpoint, at least not even a statement was made today or prior recognizing that day set aside by the UN as World Health Day. And that person is very appalled at that. At least a statement.
I don't know when last I've heard the government speak to these things. They just do not speak to those things at all. And that's as much as I will say.
Wow. All right, Nurse, we realize you have to go in just a bit, but then let us just play that statement from Dr. Tedros one more time, and then we'll ask you for your sort of, closing, wrapping up comments before we introduce Dr. Pascal very soon. Let's take those comments from Dr. Tedros one more time.
Since 1948, WHO has worked for the right to health. On World Health Day, we ask, what can you do to claim your right to health? The answer is a lot. First, know your rights. You have the right to quality health services, education, and information. Your health depends on safe drinking water, clean air, good nutrition, quality housing, decent working and environmental conditions, and freedom from violence and discrimination. Second, stand up for universal health coverage. Everyone should have access to the essential health services they need when and where they need them without facing financial hardship. Third, hold your leaders accountable. Mobilize your community, get involved in health decision making, and monitor progress, because the right to health belongs to you.
The right of health belongs to you. Thank you very much, Dr. Tedros, for those comments indeed. Nurse, before we come back to you for your sort of wrapping up comments, let us just say a good evening to Dr. Pascal.
Welcome, Dr. IP.
Greetings.
Yes, greetings, brother. How is it?
Everything blessed.
Everything always blessed.
Well, that's all I know, Lofty. That's my mantra.
Yeah, those of us who know Dr. Pascal, then yes, that is his mantra indeed. Yes, everything always blessed. So, Doc, we'll be sort of coming to you in a while for you to chime in on the conversation. But so far you have been listening. What can you say to us in terms some of your opening comments?
Okay, first I just like to apologize for not being able to join you earlier, and I had some other commitments to attend to, and I hope I can add on this, add something, and increase or enlarge or add on to what Ms. Felix has contributed so far. Unfortunately, I only listened to her on the last 5-6 minutes or so. So I hope there might be a tendency for me to get repetitive. But based on what I heard, the thing I would just like to say first of all is that what I noticed from the statement from Dr. Tedros is that it's something that I have maybe a different perspective, in that I subscribe to the view that every right you have a responsibility. So I notice in the statement, he speaks to the rights people have to health. And I figure that if you have a right to health, you also have a responsibility at the same time. And I think that is what I would like to explore the individual responsibility who has the right. I'm not so sure how much of that Ms. Felix may have gone into, but to me, there is no rights without responsibility. So I think that is something that maybe we should focus on a little bit more. And it's not just the responsibility of like the government or the healthcare providers to do those things. It's also what is the responsibility of the people who have those rights? The responsibility to themselves, the responsibilities to ensure that they have good health, their responsibilities to what they call it, agitate for better health. So I think that is really, I didn't hear that from his statement, and that struck me as missing.
Okay, cool. Well, yes, Nurse Felix touched on some of the rights. You also touched on, the responsibility part of it, a little much, but I guess you will go much more into detail. You'll expound much more on some of the individual responsibilities, as you said. So we look forward to engaging you, pretty soon. Nurse Felix, you have to go in just a bit. Just, put what you said in a nutshell for us and drive home a couple salient points, please.
Well, just before I summarize, though, there's one other one among the 15 other rights that I just want to touch on is, and that's number 6. The patient has the right to make decisions about the plan of care prior to and during the course of treatment, and to refuse a recommended treatment or plan of care to the extent permitted by law and hospital policy, and to be informed of the medical consequences of his action. In case of such refusal, the patient is entitled to other appropriate care and services that the hospital provides or transfer to another hospital. In a nutshell, what it's saying, again, because it's your health, you can choose. You're supposed to know what is the plan of care. Your healthcare provider should discuss the plan with you, and you have to give consent, informed consent. So in other words, all the information should be provided to you, and you make a decision. So you're aware of what is happening to you and what are the options there for your treatment, so that you can make an informed decision. That's important. It's not all about we just saying, okay, I'm going to give you X, Y, and Z, and you are supposed to accept it. Your money is paying for it, and you're just supposed to shut up and accept it. No. You are supposed to be part of that plan. You're supposed to, the provider should discuss with you. You should have an input in that plan. And so yes, the factors affecting both in positive and negative ways our health, we ought to be aware of those factors so that we can better contribute to our health and better sustain the good health we have, or restore it if we are not well. So safe drinking water, thank God, is one of the things. For the most part, we're on the right track here in Dominica. Although there are many concerns about excess, we call it what they used to to
chlorine.
Yes, that is a factor. So while our water may not be contaminated with bacteria and viruses, but we have concerns about the chemicals and the safe working environment. People need good paying jobs and safe working environment, whether you're working in a health facility or not. Wherever you're working ought to be safe, because when you're sick, you are no good to yourself, to your family, you lose income, you're no good to the society. Discrimination, I didn't speak about that much, but there's a lot of discrimination going on, and that's affecting people's mental health. We touched on the mental health, so people, you have a role. So the part, yes, Dr. IP, you really miss is that I did speak to people having so it's rights and responsibilities, and I'm sure you will go in that, because unless the lesson is learned, it has to be taught over and over again. So the responsibility for us to hold our leaders accountable, our healthcare providers, and ourselves, hold ourselves accountable as well. Am I doing enough? Are we, and I mentioned where our primary healthcare was and where we are now, our whole healthcare. Are we, Dominicans, are we responsible for that decline? Ask ourselves that question and hold ourselves accountable. So on that note, again, thanks, Lofty.
Nurse, just before you go, there's a question on my mind that is burning, and it would be remiss of me if I didn't ask before you go, please. As a nurse practitioner, worked in that field for a number of years, still there, in terms of privacy of information, how critical is that to the health profession? Privacy of information.
Oh, that is very, very, on a scale of 1 to 10, with 10 being the most significant, it's 11 on 10. Yes, so it's something both doctors and nurses, we take a pledge to hold patients information confidential, and the confidential, and to provide privacy too. So both physical privacy and privacy of information, protecting the information. That is very, very important. And over patients, I've heard patients complain that, their information has, been put out and nothing has been done. But again, it's a right of the patient, if your information has been put out there, to not just grumble and say, well, if I complain, they will treat me worse the next time. Make a formal report, make a formal report about it. We ought to provide patients and protect patients' information, and that's it's as I said, it's a pledge we make, and there's a nursing council, there's a medical council, and people can report to those institutions about that. So it's very, very important. That alone, a patient could be doing well, and they discover the information is in hands or in areas where it's not supposed to be, and that can affect their mental well-being.
True.
So it's critical.
Critical. All right, Nisi, I think that is all for us. Any final comments?
Yes. I think that's it for now. And again, I think I said it in the hour, so I'll yield to Dr. Pascal and give him this full hour with you.
Yes,
night. Thank you for having me, Dr.
Night,
sorry, I have to quit as you enter.
Thank you very much. I hope I can fit in your shoes. That's all.
I know you can fit in Dr. IP shoes.
I said I hope.
For sure. Okay, bye-bye, all the followers. Night. No, see you until next time.
Okay.
All right. So, Doc, that leaves us here with you being the next contributor onto the program. You basically spoke about you want to sort of go in the direction of the more aspect of responsibility. What does that entail as it pertains to the topic for discussion tonight? Where and how do you want to start, brother?
Well, I'll first start, and maybe I hope re-emphasize to the listening public this whole definition of what we mean, especially as health professionals, when we say health. So when we say this is World Health Day and health is all right, I'd just like to start by, reiterating the definition of what health is, and that health or well-being is not just the absence of what we call disease. I think we need to remind people, people in general, if you ask most people to tell them about their health, they think is, well, if they're in good health, is the absence of disease. They don't have any diabetes, any hypertension, any cancer or anything. And but we must remind ourselves that by definition, health is not only about physical disease. Health is mental, physical, and social well-being. And I underline social well-being because that is maybe an overlooked aspect of what your social well-being is, a significant factor or impacts significantly on the rest of your health. And so it's each of them play their part, and then because your mental health is just as important. It's just not to forget that part of your overall health is your mental health, and that what that means is, by I put it basically, being at peace with yourself and the world around you. If you're not at peace with yourself and at peace with the world around you, well, then your mental health basically is not optimum, is not what it should be. And that is not something that should be overlooked, because mental health conditions are increasingly becoming part of the morbidity or the illnesses that we have to deal with. Even there's a rising global trend in things like suicide and psychiatric illnesses and stuff like that. Substance abuse, all these are mental health conditions. So I think it's important when we're talking about the rights to health or to good health, that we don't overlook that. And well, we know about the physical health is, even you feel well and you feel well, you feel good physically, even if you may have some chronic illness like diabetes or hypertension, which is properly treated, which is properly taken care of. So you could have that and still feel well about it. You could have cancer. You could have other chronic conditions and feel well physically because it's being taken care of and it's being treated in an appropriate way. And then you have your social health. And even with something I maybe should have said at the beginning, I could say it after, your social health, which is about, for me, your connection to those around you, to others. What is that type of interaction you have with other people, the environment? And so social health is something that is important, that interaction with other people, in terms of it helps to distract us from problems we may have, helps us to change our perspective, lighten the moment, you build healthy relationships and have good quality relationships that connect meaningfully with the people around you. So social health is just as important, and I'll be maybe even more important than the physical health, because as we know, the mind and the unseen is all the mental, spiritual health and all of that is just as important a determinant of your physical health. And And why I think it's important not to overlook the responsibility associated with the right to all those pointers that Ms. Felix gave about the rights you have is because if you, Dr. Kelsick used to have his main theme for his health program was your health is your wealth. So automatically that means your health is your right, but it is your wealth also, so it's your responsibility. You must take responsibility for your health, even if you have rights, but there must be some individual personal responsibility that I think needs to be emphasized to ensure that you can protect those rights can be sustained, others can have them too. So, and when you think about it, at least from my perspective, is the fact that the majority of physical illnesses that you may have include, and not just physical illness, including things like trauma, road traffic accidents, all those stem from maybe irresponsible behavior in most cases of the individuals who get into the accidents. The hypertension, the diabetes, it's what you eat, it's the lack of exercise, it's the lack of going for your regular checkups to pick the cancer up before it's too late. So that is not something, although you have a right to be able to go to the healthcare facility or physician to get those, you have a responsibility to prevent those. So you're not going to, so that responsibility, I think, is overlooked, and it's not, to me, in this World Health Day initiative, is not emphasized. It's maybe a little bit, in my opinion, a little bit downplayed, and encourages the dependence of the citizen or the human individual on someone else to protect his right or to take care of his health. I think it's a very, very important aspect that's been overlooked, because if you think about it, most of the conditions that you may have to be treated with, somehow the individual can be implicated that you did not do something that you could have done. Maybe not to say you would not have got the condition, but it might have been picked up earlier. It may have been, the earlier it's picked up, the earlier it can be treated, the less cost. It may have been prevented. So, example, if you concentrated on having a healthy diet, fresh foods and vegetables, lots of water, that type of thing, local stuff, fruits and vegetables, not too much meat, not too much processed food, you could prevent yourself from even having a lot of these conditions like hypertension, diabetes, cancer, maybe at a later stage in your life when you might be more financially be able to cope with it. So that responsibility is, for me, is always associated with any right one has. There's no way you have right to anything without some degree of responsibility. And I think that is something that needs to be emphasized a lot more when we talk about health, our social health, the connections we have, the human connections, who we connect with. It's just as important as eating healthy food and getting some physical activity, because that affects your state of mind, that affects your well-being. If you don't have, to me, that social interaction that is health, that is sort of, what's the word? That is sort of lifts you up. That sort of encourages you when you're down, when you're low self-esteem and all those kinds of things. So you have to take care of that. Even if somebody tells you have the right to talk to people, you have to find yourself going to find out about the conditions, going on the internet, Googling the conditions to find out about them. So I think it's very important not to overlook that responsibility and just leave everything up to saying, well, WHO says we have a right to health, we have a right to access. That is true, but it doesn't just end there, because with rights come responsibilities. And I think, especially in Dominica now, if you look at the social health or social health, I mean, as much as we cry about and we get terrified and complain about our physical health and our lack of access and poor treatment and no this and no that, and it's expensive. Also, our social health is I think most people accept is deteriorating. The way we treat each other, the way we interact with each other, the way we look out for each other, where people can feel, well, I can always go by my neighbor and get this if I don't have it. I can get an extra hand of bananas. I don't have to go and buy some, what's the thing then that everybody likes? What's it? The noodles, what do they call it? Pasta. And
Pasta.
yeah, before your neighbor had bananas, Christopherine, fresh extra fruit. Our relationships allowed us to get some of that. A farmer would come home, he has extra, he just distributes it to his neighbors, he just distributes it to his family, that he makes sure they get some from it. So all these are aspects of our social health, but that's our responsibility. It's hard to blame anybody else for the absence of that. And so it is my view that is not being emphasized enough, and patients need to be reminded about that. If you take in responsibility for the right you have to health, you will do as much as you can to prevent yourself from getting ill. You will also put something in place for in case you get ill. So you might have a little savings aside, that you put something in every month. You could also maybe make sure you have medical insurance. You could also make sure you go for your regular checkup before you get ill. So if the thing is coming, you can catch it early and save yourself a lot of expense. So that's a responsibility that, to me, in general, I would say, not just in Dominica, that's globally neglected. True. Especially in the poor, in the poorer and underdeveloping countries.
Yeah. Doc, you certainly did put a lot on the plate so far for us to chew on. And so I thank you very much for that indeed. There are many angles we can take that conversation, but I want to zero in on really and truly some of the last things that you said. Really, the cost of health or proper health in Dominica, proper health care in Dominica. Doc, the realities in Dominica, and I'm speaking for a number of persons, in that you spoke about, persons getting their usual health checkup, persons eating healthy, fresh fruits, fresh vegetables, and staying away from some things that you call the pasta, the ramen. I saw some person put it there, things like that. Doc, the reality is the economic situation in the country. I know you spoke of the social aspect of it, whereby neighbor help neighbor, but there's a limit to that, especially if we're dealing for realities now in the country, that a neighbor will stretch hand, but it can reach that far. Your job, your type of employment, it cannot sustain past the hand-to-mouth daily activity. And so I really don't want us to lost some of the people who are directly impacted by that to suggest to them that every month put a little $10, $20 aside, get your health checks, because the reality is, Doc, some people really and truly cannot. And so I want you now to balance that based on the reality and what you said.
Yeah, but what you're referring there to is something that in the health sector, it's called social determinants of health. And these are things that determine your quality and financial wellness is one of them. So financial wellness, the economy, the economics of your life is important. So it's not saying that is not affecting your life, but it's what I'm saying is that is the reality. But it doesn't mean that it gives the human being the right to neglect their responsibility in the things they can do, because it doesn't cost you anything to go for a 30-minute walk a day, or to walk up steps, or to walk to work instead of taking a bus. You actually gain. So that's my point.
Yeah.
So my point is that they're social determinants of health, financial well-being of you, of yourself, and the people around you and your community, education, access to services, access to community participation, all these things. So these are social determinants of health. So they fit into the rights that Nurse Felix spoke about. What I'm saying is that often we concentrate so much on the absence of those rights, that the areas that we can take responsibility to minimize the absence of those rights, we don't take it. And I am saying that whether we like it or not, as much as we can point fingers of that, your health is your wealth. That is what is fundamental here. At the end of the day, your wealth depends on your health. And somehow, wherever you can, take some responsibility for it. You should. And everything else is icing on the cake. I mean, I'm saying the luxury of not taking is not helping. It's adding to the problem that you have no control against. So you have no control over the economic condition. I'm not saying it is not something that you don't have to address as a right, but simultaneously, it's without apology, I think the especially since the things that you have the right to are all, the majority of them are implicated by your behavior. So even your inability to cope with the loss of your job, which then can affect your mental health, is also your responsibility. How do you prepare yourself for that? You can lose your job. Do you live as if you may lose your job? And what do you do? So that's what I'm saying, that aspect of it. Do you say, well, instead of, okay, the things are bad, the economy is bad, going to the doctor costs me a lot of money, but getting private care or paying for examinations and tests and all of that, it's not cheap. Okay, but I can decide my responsibility to myself on that is to wherever I can. So for example, instead of going and buying soda, for example, I can get a lime and make a squash. I don't have to put sugar in it. It's the same thing. Instead of buying water in a bottle, I can go and get some water, boil it, put it in the fridge. It's the same thing. We live in Dominica. Water is clean. So what I'm saying is that the extent to which an individual doesn't pay attention to those individual responsibilities is the extent to which those so-called rights that are not being addressed will affect him or her negatively. And for me, it's as you rightly say, you have to balance it. You cannot neglect it. It's not in your best interest to neglect it, even if you never end up with a disease or so that what you would have saved by not ending up is also your wealth, is also your financial responsibility. So I don't think, my position is that as a physician working here for all these years, I don't think that is emphasized enough. And I think we tend to leave a lot of it to those people who are supposed to provide our rights to health.
Yeah, indeed.
Yeah,
Some of
so
the comments, yes, some of the comments coming in here so far, Doc, lends itself to, you know, some of the things that you're saying. I saw someone mention a while ago, Anthony Simon here says, alcohol plays a huge part on the health of the people, especially the young people on island. And Sigis here writes, it's setting priorities, and Dominicans do not do that very well. So I'm saying here, apart from the health conversation we're having, part of it has to do with the economics as well. So
yeah.
some sort of, you know, analysis, self-introspection as to, especially in entertainment, what you do there, or you cut back, what, you know, that can help in terms of preserving the health that we're talking about.
That's the right at which you have.
Yeah. There was another comment, Doc, that you said that I just needed to, you know, go through as well, is you spoke about the social interaction can lend itself to that poor health situation. And let me see if I get that note I put down there. There are certain situations that surrounds us or presents themselves that, because they are there, that will certainly affect us negatively as well, mental health in particular. The realities of our life, Doc, we're hearing about wars. We're hearing about we are experiencing some level of poverty, open quote, close quote. The economic situation that you spoke about, things are very tight. You know, persons are basically going from hand to mouth in Dominica. I know a lot of persons in that zone, hand to mouth. It is so tight. There's no room to, you know, navigate, as it were, to do the extra stuff that would really need to do to live life. Some persons are basically just surviving. And so looking at those realities, taking those into consideration, how can one now start to put those things in perspective, especially as it pertains to those external forces, I call them, to sort of protect and preserve their mental health as they navigate through that journey called life?
Well, yeah, and that's crucial. And it speaks to the fact that if you recognize that, or if we continue to recognize that health, when we talk about health, we're not talking about just physical health. We're talking about mental and social health, which are just as important to our overall health. It's that awareness and the education that needs to be ongoing to allow us to move from where we are to that place where we recognize how important these things are and how maybe easily we can play a part in addressing those things. Okay. So it goes back to, if you look at it, your mental health, I mean, that depends so much on the things you don't have control over, your upbringing, the things that you were taught are important, the things that mattered. If you want to look at it, the morality that surrounded your upbringing. So what I'm saying is that at the end of the day, it goes back to prevention is better than cure. The basics.
Yeah.
The basics. It goes back to the basics. Now, if you recognize that your social health and your mental health are just as important as your physical health, your responsibility is to pay as much attention to that as you pay to your physical health. And paying attention to that, obviously, would becomes easier if at the level of those responsible for providing health care, enough is being done. Or they do enough to bring that awareness the same way a lot was done in the heyday of primary health care to bring that awareness to physical health. But the participation of the individual didn't happen. It didn't happen without the participation of the individual in the heyday of our primary health care, taking some responsibility for their health. All the great strides that were taken, there was agency by the ordinary people out in the villages, getting involved and participating and taking a stake in the prevention activities, or even in the educational sessions and the meetings, and then adjusting their lifestyle in terms of things they had always been accustomed to, like eating a lot of starch, eating a lot of meat, processed foods, sort of neglecting the fresh vegetables and so, and maybe overeating. And in addition to that, still going to add things like the sugary drinks and so. The changes that we talk about in the heyday of primary health care didn't take place without the ordinary patient taking some responsibility for their health. So regardless of whatever it is, the success of whatever is done is still going to depend on the responsibility once you have the right.
True.
And that's basically my position. I think the rights are well known. The rights that are not being adhered to, we are well aware of it. The thing is that, what do we do about it? The only thing you can do about it, because it's you it's affecting, is to take responsibility as an individual for your health, which is your wealth.
True.
And it's really and truly, at the end of the day, just like your life is your responsibility, others help to improve it or not improve it. That's basically it. But you have to take control. You have to somehow, it's not going to happen, better health without we taking some responsibilities where we can for the rights that we think we're entitled to.
Yes, thank you, Doc. It is 7:35, 25 minutes to the hour of 8 o'clock. For those of you maybe just be tuning in at this time, we're talking to Dr. Pascal in Dominica. He's the ear, nose, and throat specialist in Dominica. Done and still continue to do a very good job for people in Dominica where that is concerned. The topic under scrutiny tonight is your health, your rights. And as Dr. Pascal is basically pounding away here, with rights come responsibilities. And so that is where we are in Dominica as it pertains to, our health situation. For those of you on the live feed, commenting, making your suggestions or comments, thank you very much. We'll come to that live feed in just a while to read some of your comments. Remember though, we have 2 telephone numbers assigned to you guys that you can call in with your comments as well. And these numbers, they are already plugged into the chat, but they are 245-2396 or 615-9470. Okay, so we're having that all-important conversation here, your health, as brother Dr. What's his name? What's his name, Dr. Pascal? You mentioned his name a while ago.
Kelsick.
Go ahead. Kelsick, yes. That was a very good mantra this brother had. Your health is your wealth, or your health equates to your wealth. And so we live in that memory as well. Let's take a little break at this time, play that statement at least one more time from Dr. Tedros, who is the World Health Organization's director. And we'll come back to Dr. Pascal for some more comments, then your comments, and we'll bring the program down at about 8 o'clock. Let's take those comments from Brother Dr. Tedros one more time.
Since 1948, WHO has worked for the right to health. On World Health Day, we ask, what can you do to claim your right to health? The answer is a lot. First, know your rights. You have the right to quality health services, education, and information. Your health depends on safe drinking water, clean air, good nutrition, quality housing, decent working and environmental conditions, and freedom from violence and discrimination. Second, stand up for universal health coverage. Everyone should have access to the essential health services they need when and where they need them without facing financial hardship. Third, hold your leaders accountable. Mobilize your community, get involved in health decision making, and monitor progress, because the right to health belongs to you.
Yes, indeed. Your right to health belongs to you. Doc, as we continue in here, Dr. Tedros made a fundamental point in aspect number 2. He's suggesting that we stand up for universal health coverage. What does that mean, you being a medical practitioner?
Okay, universal health coverage, as I understand it, or what is meant by it is that, okay, but to put it simple, it would be like something like a national health insurance that is set up, that is paid for and contributed to by the country, either the government or the taxes from the people, that allows and is operated in a way that it allows for access to a wide range of general health services. So, for example, immunization, regular GP visits, basic treatment for things like diabetes and hypertension and stuff like that. So that when and if a patient or an individual needs those services, they are not limited to those services because they don't have the cash in hand to go and purchase those services. And so that is sort of what universal coverage would look like. In Dominica, where we may say we have universal coverage, but it's not accessible. So if it's universal for the country, people must have access to it. That means when they go there, they must get it. So in terms of rights to health in Dominica, that would be something that it's the responsibility of individuals to canvass, to agitate for universal health coverage, especially for those who are less financially able, because it cannot be you're sick, you're not well, you cannot help yourself, whether it's because of your fault or the environment or whatever. And then you go to treatment with an expectation that you will get the treatment and you will get basic treatment, and you go and you are told even the most basic of things like something to relieve your pain or somebody to see you, you cannot get it because there's none available. So here you have come, not being able to afford it, or maybe because of a financial situation, became unwell, and then you go to the health services sector that you expect to get a minimum, and then you are told, well, look this, but you'll have to go and buy this because we don't. So I don't know what is the person supposed to do. So that is really and truly would be the objective of universal health coverage.
Yes, indeed. Mary Lorio is adding to the question that I asked you there. I suspect she may be in the health department as well, or health sector. She says here, in simple terms, it's coverage for the people who can't afford to pay their services. And she also added, not everyone can pay for insurance to cover their medical bills. Yeah.
Yeah, I mean, that's the point. So that's why you need universal coverage. And so that's why universal coverage is a right. Now, if with each right there is a responsibility, and you know the right, you know it's your right, then what's your responsibility then? To agitate and as he said, to what he says, hold those responsible accountable.
Yes.
That's your responsibility.
True.
You cannot, if you have those who supposed to be caretakers of the right and ensure the right is available, and they are not doing it, your responsibility is to find a way to get them to do it. So I'm saying with the right always comes responsibility. On the issue of the insurers, obviously, it's so that's why you have what they call policies and so to cater for those who may not be able to provide, have been a financial situation to have insurances. But it doesn't mean, but what you find is that even those who can afford to have insurances don't have. So that's irresponsible in my view. Because you cannot be aware of what this situation is. You cannot be aware that healthcare is also expensive, whether you like it or not. Whether it's free or not, somebody's paying for it. It's expensive.
True.
And everybody wants the best healthcare. And the best healthcare, whether we like it or not, is driven by technology. Your scans, your surgeries, your whatever. And then technology, you have to pay for it. So you're still not going to get away. It's still your wealth. So the important thing is for those who can take responsibility and have insurances to do that, because you're aware that the right, but you might have somebody who can take an insurance to prevent or to just in case they run into problems, and will not do so, will not take that responsibility and depend on a system that they are aware doesn't even provide the basics.
Sure. Yeah.
So that is your response. You cannot know that things are as bad as they are. And you can do something to protect yourself and not do it. That's the responsibility I'm referring to.
Yeah, true. Didi Easter, another comment coming in here, writes, universal health is like the National Health Service that's offered in the UK and Canada. That person writes. Annie Edwards puncher comments here at us, sort of localizing the conversation. She says, right now, patients are sent to private clinics to do most of their blood tests, scans, mammograms, etc., and have to buy their medication. This is a serious situation because some people just can't afford it. Again, Doc, the situation, of course, keep coming over and over again in the conversation.
Yeah. Well, yeah, because you it's your wealth. The cost must be, health is your health is your wealth. So there's always a financial aspect to it. And as things, what we call progress, that financial aspect is increasing every day. Because, as I said, the modern healthcare, the expectations of the patient is driven by technology. And the technology, funds have to be found somewhere to pay for it, to get the quality of service. So fundamentally, there is no getting away from that. Is what do you do now about your rights that's related to that? And I think, again, it's how you hold those who are responsible for those things, how you hold their feet to the fire to make sure you have your rights. If you have a right to $10, you have to hold the person that's supposed to give you your $10 responsible. And if they're not giving it to you, you have to find a way to get it from them or get them to do it or do something with them. So I maintain it's although it's not said explicitly, intimately related to whatever right we have when it comes to health, there is a responsibility. And what I'm saying, particularly so because most of the things you're going to need health services for are determined by the individual's behavior, whether you like it or not. It's not like the days before when it was because you had poor, unhealthy water in the pipe, or you had chikungunya or mosquito turning around and biting everybody because they didn't spray and all of those things, or even like with coronavirus and all those things. It's not the majority of things that people need health services for are not things that they have no control over. And that is what is the reality. In the days when it was 50 people in a vehicle, so if there was an accident, that responsibility would be the driver, the owner of the vehicle, didn't service the vehicle. It's different now. It's everybody's driving, so everybody has a responsibility to protect the other. And then that's to go back to the social health. Because you get into an accident, it's maybe because you didn't service your vehicle properly, you were driving too fast, you were texting on the phone. So as much as when you go for services, as much as it's appalling the fact that you have to pay for everything and nothing seems to be available, it's also appalling that this could have been prevented by an increased level of responsibility. And I'm saying there is no optimum health care, even if you can afford it, without a certain, no right in health, even if you can afford it, without some responsibility, because you may afford it and decide you're not going to see the doctor, you know. Mm-hmm. So there are lots of people who can afford to go to see the doctor and don't go, can afford to do the test and don't do it. So the point is that I think the general public is maybe for, I don't know, maybe for for reasons that, you know, I'll never know, but the general public is just, even as things are changing and it is more, healthcare services are more and more determined by the finances that the government put in it, that individuals put in it. That seems to not be a prominent part of the narrative on healthcare, or the prevention part, or the responsibility part to prevent, so your health can be your wealth, your health can bring you wealth. To me, it's not being emphasized. So it's deliberate. So you'll always stay poor. Because if you don't have health, you don't have wealth. So and I'm saying that may not necessarily be so, but the only thing an individual can do is to take some responsibility somewhere, because you have the right. And it's really, for me, it's really emphasizing the fact that there's no right one has without responsibility.
Yeah, true.
Indeed,
fundamental point. Yeah.
Yeah.
Gerald Vital, right here. An observation, though, in the past 20 plus years, the shift and polarization of politics has somewhat negatively affected our social cohesion as a people. Hence, this, I would want to think he wants to write, has dismantled social health. All right, so that is the point Mr. Vital is making here. Alex Batley writes, our health have a lot to do with the food we eat, but a lot of us don't even have the food to eat. So the only way we can eat again is for, well, Alex Batley, there's some comments that you're making here. The program that we run here is, you know, we tend to raise the bar. So, we catch the point that you're making in terms of the availability and affordability of food. But as Dr. Tedros said, Dr. Pascal is reiterating it, the citizens now can do some agitation in that regard to those responsible for that. All right, so but we get your point nonetheless. Marshall Lawrence is writing here, should Dominica have at least 2 health summits yearly? That's a direct question to you, Dr. Pascal, in terms of, his comment.
Health summit.
Yeah,
well, oh, sure. I mean, it depends on, I mean, it's health information and discussions on health and sensitization on health are absolutely necessary, especially to get more and more people to understand that they can do more for themselves and that health is not just only their physical health. Sure. And that their physical health is really dependent on other aspects of their health that they are ignoring to their detriment.
Another question here comes in. I know you're not a politician, Doc, but that person is asking here whether there's any health data based in Dominica which provides statistics as to the health of the nation, the health of the people.
Well, we have I think we're supposed to have, I think we still do, what you call a national epidemiologist who tracks those who's supposed to have that type of information available. I don't know to what extent it's up to date, but I'm not aware of any recent publications to that effect. I don't know when last even the health of the nation from that statistical perspective was addressed or even made public. I don't know it, but that doesn't necessarily mean it's not there. But if I don't know it, I suppose the ordinary citizen who is busy trying to make ends meet and struggling with his economy and all of that wouldn't have a clue of what that is. But that is also important because that tells you about trends in health, how many people dying from diabetes, hypertension, cancers, what cancers, especially if it pertains to you as a man, what's the increase in cancers, for example, of the stomach, of the prostate. I mean, you need to know that. So you can, that kind of information that might prompt you to take a little bit more responsibility and not depend alone on those who are supposed to ensure your rights.
Yeah.
So I think it is useful, and maybe not just twice a year. I mean, I think if health is our wealth, maybe every day. We have very few programs on national media on health, and it's worrying because if health is our wealth, and we're not having information that will help us improve our wealth, what we're doing is ensuring our poverty. Because poor health means poverty, because health is your wealth.
Yeah. Some final comments here, Doc, from the live feed, and then we're going to bring it to a wrap. Karen Joseph writes, I think that the universal health coverage has only been implemented in Barbados and Trinidad and Tobago. We have far to go in the Caribbean and much further to go in respect of Dominica. Mary Lorio comes back and writes, Dr. Pascal, you're absolutely right. It's the responsibility of everyone to care for their health. Gerald Vital comes back and writes here, but besides the people responsibility, what about the government's responsibility to draft, implement, and enforce health and environmental policy and service? Karen Joseph says here, good question. Is it deliberate? Brother Angelo Allen, you're listening and watching. Good evening to you. Annie Edwards, tongue twister here, says, during hard economic times, people are forced to prioritize their basic needs over medical costs. I think Doctor, elaborated on that in terms of what we can do. Francis writes here, are the people demanding better health care? That's an all-important question. And final comment for the night here, Carol Olivachi Bruni writes, most men will not visit the doctor until something major develops and that it may be too late to correct the problem. Finally here, Madeline Augustine writes, Dr. Pascal, the best nose, ears, and throat doctor in the Caribbean. That's a full endorsement you're getting there from Madeline Augustine, listening and watching. But Doc, you heard some of the comments. You know, where do we go from there in terms of your comments? Your wrapping up comments, that is. And your you know, how do you want to drive home some points before we close?
All right. Well, I'd just like to remind the listening public that things have changed. As we say, change is a must. Things have changed significantly in our health status, both individually, collectively, and nationally. And things are not what they used to be, and that's the reality. In truth and in fact, in my opinion, things haven't got better. If anything, they have got much worse. So basically, it requires us to change as well. Because if things are changing around you and you're not changing, you'll be the one suffering the most at the end of the day. So, I just like to emphasize that the reality of the change of things being changed, it's there. Secondly, that I like to reinforce that your health is your wealth, so it is your responsibility, and it's not just about your physical health. More and more, the studies are showing that the degree to which most of these physical conditions manifest is influenced by your mental and social health. Hence, if you notice, there's a lot of emphasis now on other things like your state of mind, yoga, mindfulness, that type of sort of alternative approach to dealing with health issues. And that is simply because it's recognized more and more the extent to which these other aspects of health have been neglected, or maybe not neglected, but just weren't understood the way they're understood now, and their importance in influencing the morbidity and mortality associated with physical health. I think as a social people, I think social health needs to be much more emphasized because that allows us to be more individually responsible. The physical health, after you got it, you're much more dependent on factors outside of your control. Trained and experienced healthcare professionals, proper health services publicly and privately that you can afford or that you can have access to, and you have less influence on. And your health basically is your wealth, but don't neglect the mental and so and some things we can do. I mean, there are things that simply we can do if we recognize the social health on that, or even the mental health. And I mean, I'll leave that up for the psychiatrist, and Dr. Benjamin and the like. But in terms of social health, yeah, it seems about, I mean, taking a little bit more control of your individual life, balancing, you know, how you spend your energy, where you spend your time, how much time you keep to yourself, how much time you allocate to look out for yourself, and balance that about caring and helping others. How often you accept yourself for who you are, be yourself, and because all these are the things that bring all the stress, trying to be like others, trying to have the latest this and eat the latest that, and I mean, all of these things affect your mental and social health, and by extension, your physical health. How much you know, the usual things, how much you interact with the community, the things we used to do, play sports, team sports, the church community, and all these things are a significant part of your health and your wellness and your well-being. So it's not like there's nothing that you can do, even if everything is stacked against you, or it seems everything is stacked against you from the state of affairs in Dominica right now, vis-a-vis your expectations and the right. But it's not like about throwing up our hands and feeling there's nothing else we can do, because there's lots we can do in the other aspects of preventing physical disease and stuff that we are not doing, and we can do. We can do a little bit more for ourselves individually, in addition to advocating. Well, that's the word I was trying to get for the earlier, advocating for the right to health, which is mental, physical, and social well-being.
Well put, well said, well put. Doc, I want to thank you very much on behalf of the thousands viewing now, because this is a global program. We want to thank you very much for your invaluable contribution to tonight's program. Whenever you're called upon by myself, you always respond, so
I try.
Again,
I try.
I just want to thank you. Thank you very much.
You're welcome. Thank you, love. To keep up the good work.
All right, my brother. One love. Take care. Well, Doc, one of his words was change, huh?
As a true Dominican, I really think we could make it. But as a people, we have to learn to commit. The journey ahead will never be smooth and sweet. But as an ambitious nation, we have to be upbeat. I know we have done it before, so we can do it again. All the pain we've endured, but pride we have to maintain in order to create a better world. Every living soul has to play their role. We have an opportunity to change things around, an opportunity to change things, an opportunity to make Dominica strong. We have an opportunity to change things around, an opportunity to change things, an opportunity to make Dominica strong.
An opportunity to make Dominica strong and change things around, sang by Joy Stout.
Jealousy, not by me, certainly. We got to stand for goodness.
Just on an advertisement or announcement note before we go.
Not by me, certainly. Tomorrow is the first day. The rest of our lives, let's make tomorrow the first day.
Tomorrow, if the good Lord above is willing, yours truly will be in Wesley, in the Wesley area, bringing live the funeral service of Mr. Kenneth Telemack.
To make our country strong.
That is the uncle of our dear Paula Celestine. Again, just to repeat, yours truly, tomorrow, the good Lord above is willing, I will be at Wesley tomorrow, bringing the live funeral service of Mr. Kenneth Telemack, who passed sometimes 2 weeks ago.
I remember the love and unity that we once shared. Starting from the home, the children would be prepared.
And just by the way of information as well, tomorrow is the big day as well of Paula Celestine. Tomorrow is her birthday. Actually, her uncle, Mr. Kenneth Telemack, to rest. Paula, good evening to you, my friend. Have a pleasant evening. See you tomorrow, Paula.
People were real discreet. We need to go back to where we.
So Dominicans, that's it. Fans and friends in the Caribbean and or further afield, thank you very much indeed. Another Civic Vibes program. Good night.
Change things around, an opportunity to change things, an opportunity to make Dominica strong.
Oh, finally, to our guests who made their contributions tonight, that is Mrs. Rosie Felix. And we just heard from Dr. I.P. Pascal. Good evening to you guys. Thank you very, very much indeed. To our fans and friends here and abroad, we thank you as well very much. See you next week, same time, same place.
Oh, conspiracy, jealousy, not by we, certainly. Tomorrow is the first day. The rest of our lives, let's make tomorrow the first day. rest of our life. We have an opportunity to change things around, an opportunity to change things, an opportunity to make our country strong. Change, change. Grandma used to say that laziness is a real crime. It captivates your body, then retards your mind. As a people, we have to change this old attitude and give our country all the love we really should. Instead, we sit and we criticize, where we say let's now analyze and give young people no scope in difficult times just how to cope. It's for us to build them the foundation in order to build a stronger, vibrant nation. We have an opportunity to change things around, an opportunity to change things, an opportunity to make Dominica strong. We have an opportunity to change things around, an opportunity to change things, an opportunity to make Dominica strong. We got to stamp out crookedness, stamp out all slackness, jealousy, not by we, certainly. We got to stamp out the negative, what's unproductive, treachery, not by we, certainly. Tomorrow is the first day. The rest of our lives, let's make tomorrow the first day of the rest of our life. We have an opportunity to change things around, an opportunity to change things, an opportunity to make our